the Peabody Picture Vocabulary Test, the 4th edition, and we are addressing the cultural considerations.
We will begin by evaluating the psychometric properties of the PPVT. We will then talk about modifications that are recommended by the test makers for individuals from CLD backgrounds. We will then list and explain sources of bias that we have found for CLD groups. Lastly, we will suggest some of our own modifications for test administration for CLD groups. The PPVT is a test of receptive vocabulary normed for individuals aged 2.5 to 90. The test makers claim to measure the examinee's achievement in acquiring vocabulary. It's important to note that it is for individuals who speak standard American English. It requires no reading and writing, and it does come in parallel forms.
The test makers completed a comparison of the PPVT-4 to other measures. These comparisons provide convergent evidence for the validity of scores. This validity measures whether the PPVT-4 measures the intended construct, vocabulary knowledge. The test was compared to the expressive vocabulary test, comprehensive assessment of spoken language, clinical evaluation of language fundamentals, and the group reading assessment and diagnostic evaluation. In terms of expressive vocabulary, analysis of these tests revealed uniform correlations for all ages. The average correlations were lower than the standard 0.9, as the EVT2 also measures the construct of word retrieval. However, this measure is still an acceptable level of correlation. For oral language, the correlations are moderate to high. The scores indicate the Castle lexical semantic composite is most closely aligned with the PPVT score with a correlation of 0.79, while the Castle and PPVT-4 do not measure the same constructs. To assess the relationship between PPVT-4 scores in relationship to reading achievement, the test creators compared it to the grade. The overall pattern reinforces that vocabulary plays a central role in reading comprehension, as the total score correlation is moderate, and the vocabulary and concept scores correlate moderately strongly with the PPVT scores. Comparing the current PPVT-4 to the previous version, the PPVT-3, assesses the degree of continuity of construct measured by the two editions. The high correlation indicates a strong relationship between the two, though the average is lower than the correlation of 0.89 between the two PPVT alternate forms. Mean scores are identical between the two. The PPVT can identify deficits in the English vocabulary, specifically targeting receptive language and non-expressive language, unless the PPVT is used in conjunction with the EVT or the expressive vocabulary test.
Based on the normative data, individuals did score differently depending on specific characteristics. Individuals with speech impediments differed only moderately from the general population, while individuals diagnosed with language delay or language disorder tended to score 10 to 13 lower mean scores. Those with hearing impairments score lower by around 17 points, but due to the auditory nature of this test, that is a challenge. Individuals with intellectual impairments tend to score around 26 points below the general population. Students in gifted programs score around 13 points above the norm. Individuals with reading difficulties, EBDs, or ADHD score 7 to 10 points below the norm.
For empirical data, there were no studies included in the manual. However, there was multiple regression to control for the differences due to demographic characteristics. This analysis method is similar to using a demographically matched control group, but is more sensitive to small differences and more likely to produce statistically significant results. The following racial and ethnic groups are represented in the PPVT-4. African American, Hispanic, White, and Other, which includes American Indians, Alaska Natives, Asian Americans, Pacific Islanders, and other groups not classified as African American, Hispanic, or White. The race, ethnicities, population percentages were in close agreement to the U.S. population.
The level of education was used to approximate socioeconomic status, or SES. The norm sample matches the U.S. population closely on education level. Individuals from each of the 4 geographic regions were chosen to be part of the sample. The manual claims that the sample is in close agreement to the general population in terms of geographic region. In each of the racial groups, as stated before, the SES distribution was found to be comparable to the national population.
As stated before, the manual does describe a variety of demographic characteristics. However, this test was normed exclusively on individuals who are proficient in English, so it is not best practice to report a normative score of an English language learner. However, it may be used to assess the extent of standard American English vocabulary knowledge and may be used as a starting point to determine intervention for those who wish to become English proficient. The sample does not include bilinguals, monolingual Spanish speakers, monolingual English speaking Hispanics, monolingual English speaking Asians, or any other such group. An additional PPVT test item was made, and we determined if the target response is hat and a CDL child has never been exposed to specifically a cowboy hat, the individual may not choose the correct answer. A more appropriate target would be the sun because most individuals have been exposed to the general concept of a sun.
Some suggestions submitted by the test makers for modifications for those from CLD backgrounds. Omitting test items is not allowed. The manual states that some of these items may be more or less familiar to individuals from different backgrounds. However, these items will be balanced out due to the high number of test items. Additionally, the PPVT can be used as a criterion measure to assess the extent and nature of a person's knowledge of standard American English words. And the test does allow for extra time for responses.
Two sources of bias are noted in the PPVT, and they are format and linguistic bias. As far as format bias, the PPVT requires pointing to test items. If the client is unable to point, the clinician can use another nonverbal response method, such as shaking the head when touching a test item. However, the format bias present in the PPVT is content bias. Labeling or pointing to objects or actions may not be a typical language experience for Hispanic children. The PPVT norms should also not be used for someone who is not proficient in English due to the linguistic bias, as these items are based on standard American English. For example, children who have never been to the zoo are familiar with birds. Children who have never been to the zoo may not be familiar with birds and may be unable to answer item 191, which refers to a penguin. There are some modifications in the way the test is given for CDL children. Wyatt suggested that we can allow the CDL child to exceed the ceiling in order to achieve a greater number of responses, as well as we can give the client a longer time period to answer test items. The PPVT can also be used as a criterion measure to provide descriptive data, and dynamic assessment can be used to determine if the child is capable of learning new vocabulary.